a client-centered psychotherapist specializing in animal-assisted therapy. Graduated with Masters with Madras School of Social Work and also completed a Masters in Counseling. She was passionate about animals and wanted to combine her love for animals and humans and enrolled in a course on animal-assisted therapy in Colorado, training under Linda Chasman, the founder of Animal-Assisted Therapy Program of Colorado. She has since returned to India and now practices in Chennai with her pet cat. Please welcome Anjana Thampy, who will give us an introduction to animal-assisted psychotherapy.
I'm an animal-assisted therapist, and I found my calling when I was 8. That is my best friend, and he was my friend, a parent, and a peer all rolled into one. We would spend all our time together. He would be waiting when I'd come back from school. And thinking back to that time, I think that was the happiest I'd ever been. Which sounds strange. I'm sure I had a lot of issues going on in school, just like all of us. But it didn't matter because I had him when I came home. So I decided, during the course of school and college, you kind of start asking yourself, what do you want to do with life? And I decided I wanted to work with animals. Going forward almost 20 years later, that is me at a ranch actually doing my training in animal-assisted therapy. My plans started out with me wanting to be a veterinary doctor. I'm really glad that didn't work out. I found psychology, but the need to work with animals was still very strong. And so I heard of animal-assisted therapy. Unfortunately, at that time, the opportunities were quite limited in India. It is still a growing field here. So I took some time, a couple of years, before I found the right place to train, and that was at animal-assisted therapy programs in Colorado. In the little time that I have, what I'd like all of you to take away is the basics of animal-assisted therapy, which is what it is, why it works, how it works, who it's for, when it can be used, and where it can be used. So what is animal-assisted therapy or animal-assisted psychotherapy? The definition, there are 4 basic components to it. One is that it is a goal-directed intervention. The animal meets a specific criteria, so it cannot be just any animal that you've picked up or adopted. It has to be administered by a professional with specialized expertise in this field, and it has to be within the scope of their practice. Animal-assisted activities differs from animal-assisted therapy. Even though it comes under the same umbrella, animal-assisted activities can be used in motivational, educational, or recreational situations in a variety of environments. That means not just in a therapeutic environment. And it can be administered by paraprofessionals or volunteers. You don't necessarily have to be a certified professional. The important factor that makes animal-assisted activities different from animal-assisted therapy is that there is an absence of a specific treatment goal, and you are not required to take detailed notes. And the visit content is spontaneous, which means I'm sure all of you have seen videos of dogs or cats or donkeys visiting people at nursing homes. That would be an example of animal-assisted activities. A little bit about the history. Animals have long been part of our lives. William Took, anyone that's done psychology here will know, the Quaker, he was the first person to talk about more humane treatment methods for the mentally ill in his treatment center in York. And he included small animals, taking care of small animals and interacting with them as part of their treatment. Bethlehem Hospital in England soon followed suit. With the exact same thing. They had small chickens and rabbits and other farm animals that the patients were required to take care of. Sigmund Freud also worked with his chow Joffrey, and that actually came as a surprise to me. But he worked, his dog would often be sitting in sessions, and he found that his clients found it easier to talk about the shocking nature of their issues. when the dog was present because the dog would not react like most people would. Florence Nightingale also worked with small animals, small birds and other little critters. But the credit for this field goes to Dr. Boris Levinson and his dog Jingles. Boris Levinson was in a session with a particularly difficult child client. I believe he was 12 or 13 years old. And after multiple sessions, had not made any progress with this child. Having left this child alone by mistake with his dog, when he came back, he found this child playing, engaging, laughing, and being, really happy. And after that, Boris Levinson decided to bring his dog to session every time. It was then called pet-facilitated therapy, and it has grown into animal-assisted therapy today. So he is often referred to as the father of animal-assisted therapy. Why AAT works? Now, one of the things I believe as professionals we often end up doing is we often look at the client just as their diagnosis. We try hard not to do that, but with years of practice, I've seen a lot of professionals do that. Animals don't wear those blinders. They do not. When they're looking at you, they are not seeing. When they're looking at the client, they are not seeing what the diagnosis is, but they're seeing a person. They're seeing the sum, which is greater than all the parts put together. Acceptance, unconditional acceptance. It's something all of us need, and it's something we get when we work with animals, especially dogs. It is a holistic approach, so it's trans and interdisciplinary. Animal-assisted therapy can be applied with a little bit of creativity to any goal that you are trying to achieve. It can work across all sorts of disciplines and all sorts of situations. Animals work as a great transitionary object. A transitionary object is anything like a blanket or a toy that provides comfort to a child and helps ease the transition from being completely dependent on their attachment figure to completely independent. Pets make a great transitionary object because they're alive and they're more engaging than, say, a blanket or a toy. Animals also have sensory-based thinking. That's something that Temple Grandin had talked about, that they think in pictures and not in words, just like a lot of people on the spectrum do. That makes it instantly easy for animals and people on the spectrum to understand each other and communicate and interact. Another reason why it works is that clients, especially children, tend to get immediate feedback when interacting with an animal. Pulling or pushing, hitting, or being kind, quite instantly, with the reaction of the animal, you understand whether it is good or it's bad, or whether this is working or isn't working. And there's minimum consequences. If you've picked the right animal to be your therapy animal, and if you are practicing it right, then there will be minimum consequences, because there's not going to be any backlash, there's not going to be any fighting or biting or anything like that. So it's a good way for people to learn what is appropriate and what is not appropriate. And of course, the motivation to engage in therapy. Therapy is challenging, and it can be very uncomfortable. We often push them out of their comfort zone and make them change things that they're used to doing. So it can be very uncomfortable. Having an animal around instantly changes their motivation to be in therapy. In fact, it's a joke I make a lot. Most of my clients come to see my dogs and my cat, and not me. And they love it. They love it like that. What are the benefits of animal-assisted therapy? It fosters empathy. That is something that is very important in social emotional reciprocity for people on the spectrum. It's often something they lack. And in interacting with an animal like that, they can learn how to be empathic. It provides lots of opportunities for socialization. Just starting from greeting to talking to training and leaving after the session. I'll cover that in my case study, but it can really make a difference to their social skills. Physiological regulation. Petting and brushing a dog or a horse or a rabbit can be a great way to achieve physiological regulation, especially when they have very high stimming behaviors or a high sensory need. It also lowers anxiety and increases confidence. Just the acceptance of the animal that is in front of you. And this is also, I'll cover that in my research. And a lot of studies have shown that just simply petting an animal will reduce your blood pressure and reduce the anxiety that you feel. And it also reduces initial resistance to therapy. Any psychologists here will know what I'm talking about. A lot of clients come to therapy completely resistant in the beginning. These animals somehow get right under their defenses, and before you know it, we're in the therapeutic process already. They also act as a great thermometer for the therapist. Often, the animals that I've worked with have helped me gauge the temperature or what's going on in the room. They see so much more than just what we see or what we're trained to see. For example, once I was working with a teenager who was struggling with suicidal ideation, and she had had a couple of attempts as well prior to that. And she worked with the horses at the ranch that I was at. So it was a typical session. She walked in, we went to the arena where the horses were, she took all the supplies, and we went up to this horse, her favorite horse, who always came to greet her. And I did the usual check-in, how are you doing, what's going on? And she said, oh, I'm doing great, I'm doing fine. This horse, his name is Cody, and he was actually pictured in the picture that I had up earlier. He refused to hang out with her. He refused to come greet her or look at her. And to me, that is something that is very unusual for Cody. And for my client, it's something she's not used to. And so if you know a little bit about horses, you know when they are engaged with you, they look at you, their ears are perked, facing you. And everything about his body language is telling me that he did not want to engage with her. And he had turned around, and he walked right to the opposite end of the arena. I happened to track that behavior, and I mentioned something to my client, and immediately she broke down crying and went on to tell me about how she was not okay, even though I had asked her how she was doing earlier. Believe it or not, the moment she started crying, Cody walked right back over and came and nuzzled her and cuddled with her and was engaging with her. So his behavior really helped find a little bit more for me about the client and understand what was going on for her. So they work as great thermometers like that. How does AAT work? So on this, for autism, the language impairments, social deficits, and repetitive behaviors are three major features. Animal-assisted therapy very obviously works the most with the social deficits, while it also helps with language impairments and repetitive behaviors. The animals are a great medium for expression of the client's inner world. The number of times that I've heard children talk about bullying or fights with their parents, all projected onto the animals. So it is hard for children to talk about what's going on with them just directly when it's about them, but it becomes so easy, and this is often a lot of narrative-based therapies also use this. When you're talking about someone else, you project what is going on for you in your inner world onto another object, or in this case, an animal. The situation that is created by the presence of this animal. I call it practicing life. You often come across similar situations that you would face in life when you are in a room with an animal, like how do you make friends with this animal? How can I get to know a little bit more about it and make friends? How do I express love to this animal? How do I say sorry? How do I learn how to handle fights and conflicts? These are all situations that arise in everyday life, and just having a third relationship, a third entity in the therapeutic relationship helps create that situation. They also are a great sensorial medium through sound, smell, movement, touch, and sight, depending on which it is that is your highest sensory need. Sometimes it's all for a lot of children. Then their aliveness as a medium as well. Most transitional objects for children tend to be something inanimate. When it is an animal that is alive, it makes a huge difference. This is a whole other life that you have to learn about, understand, and deal with, and interact with. That makes a big difference to the children. It is also a medium for the therapist to overcome client resistance, like we talked about. And the animal here acts as Ogden's analytical third. That is a third subject that is unconsciously created between the therapist and the client, and it takes on a life of its own. In this case, the analytical third is the animal itself, and the three-way relationship and the situations that it creates help children deal with whatever issues it is that they have. The question about when you can use animal-assisted therapy and who it can be used for can be answered together. If you ask me, I will tell you it can be used anytime and with anybody. But there are, of course, always a few exceptions. If the client is afraid of or dislikes animals, then it is not an ideal situation to work with animals in this case, unless it is a direct goal of treatment. There are some people that come to get over their fear of dogs or other animals. People that have allergies or sensitivities to fur and hair, again, not suitable for them. People and clients that are extremely violent and unpredictable for obvious reasons. For the safety of the animal, for the safety of the client as well, because if the animal decides to react to any violent action, then it can be unsafe for the client as well, and for the therapist. People with immunodeficiencies and people that have, tend to get diseases and infections very easily, not ideal for them. And people that have physical vulnerabilities, like geriatric clients or infants. It is a very physical interaction when you're with animals, and that is one of the reasons that if you're physically vulnerable, this might not be a good idea. Which animals to work with? I very intentionally use the term work with over here, because animals in this case, in this field, are your co-therapists. So a good animal-assisted therapist will not use the word use animals, we say we work with animals. So you obviously want to pick an animal that's disease-free. This is what I call a relationship ability. The entire basis of this field is based on making and building a relationship with this animal and finding how to deal with your issues through this relationship. Seeing yourself in a completely different light, experiencing yourself differently. So can you build a relationship with this animal? That is one of the things that you think of when you're picking an animal. And the history of domestic working with this animal, so for example, dogs have been part of our lives for over 5,000 years now, I believe, and the safety of working with them. For example, you wouldn't pick a tiger to work with for obvious reasons, whereas a dog or a cat might be a lot more safer. Access to these animals. Dogs, why we see and use, work with dogs the most is because they're very easily accessible. Some of you would have heard of dolphin-assisted therapy also. Dolphin-assisted therapy, while it has been shown to be quite beneficial, access to dolphins is limited. So in that case, it's important to make sure that you actually have access to the animals that you want to work with. Predictability and trainability of the animal. You have to be able to predict their actions to a certain extent. And trainability, they have to be basic trained. Now, there is such a thing as overtraining, I think, in this field, because a lot of the times, some of the interventions that we do with these children includes training these animals. So for a very basic, for example, with a dog, a sit, stay, down, and wait is very important for multiple reasons, but mostly for the safety of the client. Often in my sessions, if the child is running or having a breakdown, I do need to have my dog stay and wait. And if she's not able to do that, then it can be dangerous for the client and for her. But anything further than that, like a spin or a speak or simple things like that, I actually have not taught her these things. I have my clients teach them. So it helps them with speech, it helps them engage, it helps them make eye contact, and multiple other factors involved. So a very basic training is what is necessary. Anything more than that, it's not harmful, but it is an advantage if they're not overtrained. So dogs, cats, horses, donkeys, goats, birds, llamas, camels, I've heard of all sorts. Some people even work with reptiles. It's not a preferred animal for a lot of people, but there are some clients that really like spiders and Komodo dragons, and it works for them. Picking your co-therapist. How do you pick a therapy dog or a therapy animal? Their physical health, of course, is very important. That being said, there are some animals, I don't know if you've seen this video on the internet of this dog that has Hope. I think she has only 2 hind legs and no front legs. There are some animals that can be worked with even if they're not completely healthy. In this case, as long as they're disease-free, it's fine. But their story can be very, very powerful for a lot of people that are working through their issues. So the symbolism and the metaphorical power that is in their stories can be an advantage in this case. The temperament of the animal, very important. Obviously, you do not want a moody, anxious, or unfriendly animal. You'd want to pick an animal that welcomes interactions with humans and actually enjoys interacting with them. For the spectrum, there are 2, it's mostly dogs are what we work with when we're working with people on the spectrum. There are 2 ways that you could go about it. One is picking a dog that is very calm and soft and gentle in its interactions with children. This is especially an advantage when you are working with children that can be easily knocked over or hurt. Another way to go is to get a young, a very excitable, very energetic dog. This can help keep their physical regulation up, and generally they tend to engage these clients a lot more. Basic obedience and training, which we covered, they do have to have at least a basic obedience training. And they have to welcome interactions with humans. There is a minimum age requirement. So typically, the personality of an animal takes about 1 year to 2 years, depending on the breed, to set in. You do want to make sure that they have, their personality is set and is not still developing. So that helps you decide whether the temperament is suitable for therapy or not. And the handler-animal bond is very important. You have to know your animal really, really well. If you don't know your animal, you're not going to be able to tell what's going on in session for them or for your client. So knowing your animal and that bond is very important. It also shows your client. It's a way to model for them what a good, healthy relationship can look like. Where can you use animal-assisted therapy? There are multiple settings. Play therapy is the most obvious one. Correctional facilities, prisoner animal programs. There are a lot of PAPs in the US where they have prisoners work with and train dogs to be therapy dogs or service dogs. And then it helps. It has all the benefits for the prisoners, and eventually they give these dogs up to people that really need them. And so it's a win-win situation. School and office settings, of course, and courts and trials. Courts and trials, where during giving testimony, people are dogs are brought in and it helps them keep calm. And in nursing homes and hospitals, like we covered already. While working with animals, a natural habitat is preferred, though, of course, today, all of these settings that I mentioned above are not natural. When they're in their natural environment, animals tend to be more at ease, and it brings about their natural behaviors, which is which is the point of animal-assisted therapy. Interspecies interaction can also be a good thing. It provides, again, a lot of different situations that children can see and learn from. And weather and climate considerations is another thing to think of when you're working outdoors with these animals. This is the case study that I wanted to discuss. This was a 5-year-old boy whose diagnosis was ASD. He was low functioning. When he was brought to us, all the places he went to previously had told his parents that there was nothing that they could do for him. And this was just, he would probably never walk. He had very limited mobility, fine and gross motor skills were really poor. He had difficulty walking and poor eye contact, audio, visual focus and attention, very, very high stimming behaviors, and very poor socio-emotional reciprocity. I've been working with him for about 6 months now, and all of these things that I've highlighted here, everything has improved thanks to working with my dog. That is some research that is available, and I can tell you more about that later, maybe. There are some ethical considerations while working with animals. Animal welfare is, of course, of equal consideration, so you do have to think about the importance of their well-being. They have to enjoy the work, not just tolerate it. They also, because they're working animals, they do have to have limitations on the number of hours that they're working, sorry, I'm just going to go back. Suitability assessments for these animals have to be ongoing and continuous. It's not just once that you've assessed whether they're okay to be a therapy animal. You have to keep doing it every few years because things change. And practitioners have to be objective about it. One of the easy ways to remember what is important when working with animals are the 5 freedoms. The freedom from hunger and thirst, freedom from discomfort, freedom from pain and injury and disease, freedom from fear, and the freedom to perform natural behaviors. These are some of the challenges that you face in this field. One is awareness of this field at all. It is still such a new and growing field. Not a lot of people know about it. There is still stigma attached to seeking therapy. Social perception of animals tends to be mostly negative. So not a lot of people are aware of how they can meaningfully and positively interact with animals. And of course, religious and personal factors play an issue over here. These are some of the programs and foundations in India that are working on animal-assisted therapy. They are mostly limited to dogs, not a lot of species are included, and that is my team that I work with, and the hope is that in the next few years there will be more animal-assisted therapists. Thank you.